Today I'm going to talk about the role of chemotherapy in early breast cancer. Now, to start off, this is quite a basic video, and it just gives you an overview of the role of chemotherapy in early breast cancer. And what I mean by early breast cancer is breast cancer that hasn't already spread to the rest of the body, so patients with stage 4 or metastatic cancer. I will talk about that in a separate video. Here I'm concentrating on patients who present with breast cancer that hasn't spread beyond the armpit or hasn't spread at all. Some of these patients will have chemotherapy. What is the role and what are the factors that determine whether you have chemotherapy or not? Again, this is not a detailed review. This just gives you an overview of the role of chemotherapy. Now, most patients who present with breast cancer, almost 90% present with early breast cancer. That is cancer that has metastasized. However, eventually 25% of patients who die, unfortunately, with breast cancer will die because of metastases, because the cancer has come back and spread to the rest of the body and the body becomes overwhelmed. So chemotherapy does have a role in reducing that risk, and I'll talk about that shortly. Now, first of all, when we talk about early breast cancer, chemotherapy comes either before or after surgery. Often and traditionally, you have surgery to remove the tumour from the breast and surgery on the axilla or the armpit, and then you have chemotherapy afterwards. Sometimes and quite frequently these days, you'll have chemotherapy before surgery, but they are often partnered together. And so what is the purpose of chemotherapy? It's essentially, there's one main reason and also an added reason for certain patients to have chemotherapy before surgery. The main reason to have chemotherapy is to attack any cancer cells that have escaped the main tumour. So when you first present with a breast cancer, the cancer has already been growing for weeks or months. And by that time, some of the cancer cells have already escaped the main tumour and gone into the rest of the circulation. Even if your scan shows you don't have any, there may often be cancer cells there. And your body is able to deal with most of them, but sometimes it's not able to, which is why some people get metastases. So when you have chemotherapy, the purpose of that is to kill these cancer cells in the circulation. Now, chemotherapy is toxic. It can also damage it does damage the rest of your body. So therefore, over the years, regimes have been developed so that it's toxic enough to kill the cancer cells, but not so toxic that your body can't deal with its effects. So that's the main purpose, is to kill those cancer cells that are circulating. And then this, the evidence has shown that this reduces the risk of the cancers coming back in the future, because they can come back years, sometimes decades later. And the chemotherapy reduces that risk of them coming back and reduces the risk of you dying from breast cancer recurrence. The second reason, in a certain number of patients, chemotherapy is performed before surgery to shrink the tumour. So the tumour may be a certain size. Chemotherapy is given beforehand because it would have been given after anyway, but it's given beforehand to shrink the tumour, so that therefore you're able to have less radical surgery. So you can go from needing a mastectomy where all the breast is removed to breast conserving surgery, and to have only part of the breast removed, and therefore not needing to have your breast removed and reconstructed, for example. But still, that same chemotherapy also has an effect on targeting the cancer cells that have already escaped the tumour and gone into the rest of the body. So what determines whether you have chemotherapy or not? There are two factors. One is the cancer factors, the second are patient factors. Again, this is not an extensive video, I'm not going to go through all the evidence, it's just to give you an overview. So tumour factors are basically if the tumour is of an aggressive type that's likely to have shed cancer cells into the circulation and it has a high risk of the cancer coming back without chemotherapy, then these patients, those patients who have that tumour will benefit from chemotherapy. So things like receptor status, you may hear things like ER negative or triple negative. Certain other factors, other receptors that the cancers may have. The size of the tumour may also determine whether you have chemotherapy and whether we know that the cancer has spread to the armpits or not. And this is obviously an evolving field, but definitely patients who have clear metastases to the axilla or armpit do benefit from chemotherapy. That's a cancer-related factor, so they have chemotherapy either before or after surgery. The second factor is patient factors, so whether the patient themselves will benefit. So this is things like the patient's health and also their age to an extent. So if the patient has got no major medical problems like heart failure, like severe kidney failure, then most patients will be able to tolerate chemotherapy. Now, not all chemotherapy is the same. Some patients with severe medical problems can tolerate certain types of chemotherapy, and that's up to the oncologist to decide. And also their age. So I'm not talking about patients in their 60s or 70s, I'm talking about patients in their 80s or 90s. Those patients tend not to benefit from chemotherapy because their life expectancy, even if they're very fit, isn't very long. So this is not to write off that patient, it's just to say that if you're going to go through a very toxic regime, which puts you at risk of severe infections and severe complications, you're not going to benefit in the long term from having this quite radical chemotherapy. So the patient has to benefit from their life expectancy and a significant impact on their risk of recurrence, in addition to the tumour being the right tumour that benefits from chemotherapy. I hope that makes sense. It's all about balancing the risks and benefits. Chemotherapy is beneficial. It reduces your risk of cancer coming back. But if you're having a low risk tumour that's not likely to come back and not likely to kill you from metastases in the long run, then there's no benefit in you having the chemotherapy. So I hope you've benefited from this video. I hope it's not too complex. I hope it's not too simple either. If you have, then please check out some of the links below. Subscribe to my channel, and I'll see you on the next video.